them because I have to show this to my colleagues also.
Okay, great. And as I said, Doctor, we can always schedule subsequent meetings with your colleagues as well, because the recording that we do will be specifically on what I'm showing, but there could be questions that you may come across that may not have the answers in the recording. So I won't mind doing multiple sessions for you as well.
Right.
So I have started the recording there. So
Okay.
I am currently logged onto the program, and typically the way you would log in is that you will have the icon or the URL for you to log on to the program, and I'll go and put my credentials in. So I'm logging as a provider. So as soon as I log in, I can see the patients that are scheduled for today, why they're
That's
coming
the
in.
opening. The opening screen will be the schedule.
The opening screen is your home page. This is not the schedule. This is just providing you that these are all the patients scheduled for you to see today, but the scheduling
Right.
is done on the scheduling area.
I got it. But this is today's schedule. That's the home page.
That is correct.
Okay.
It also gives you the status in terms of the reason for their visit, or who is seeing, because I can also see the filters here. Am I looking at all the providers schedule or visit types, and also those options are available there. I only want to see my home health visits, or I only want to see the hospital visit. So I can customize based on how I would like to have my home page set up. Not only that, I also have different columns, like I'm seeing these columns here, and I can actually move across these columns in that manner. But let's say I want to increase or decrease the columns, I can customize my own columns on what I want to see on my home page.
Okay.
Okay. Now, here again, I can go over any of the patient information and all by clicking on the three dot button. That will go and show me all the details on them. However, when I want to go and schedule a patient, I go to the appointments and say schedule. This is my daily appointment scheduling window. When I hover my mouse on any patient, you can see the details of that patient coming up. The way I schedule an appointment, I just double click on a time slot that I want to schedule an appointment, and the dialog box pops up. So here, again, you have the option, am I scheduling for this provider or a different provider, this location or a different location? Is the patient coming in? I'm seeing, are they for an office visit or a follow-up or a consultation or a procedure? Depending upon the encounter type, which are all customizable, the appropriate duration that I typically assign for that kind of encounter will automatically show up, which can be modified or changed as well. The name of the patient. Let's say the patient name starts with the letter H. I start typing it out. As I start typing it out, the names appear there along with the date of birth. So I could go and say, select the patient in that manner. But if I need to search the patient with a different criteria, I can click on this binoculars, search the patients with the first name, last name, sex, age, chart number, SSN number, home number. These are all going to customizable screen based on how we would like to filter your patients.
Got it.
Okay. Now, the reason for the visit, I can type the reason in the patient own words, or I can have my predefined list of reasons why typically the patient visits my practice. So let's say this patient is complaining about, let's say, shortness of breath. I start typing it, filters out. I could go and select that. I can also go and put my comments in. I can double book an appointment. I can put the patient on a wait list. I can also see if they have canceled, no-show, rescheduled appointments as well. I also have the option to search for appointments. Let's say the scheduling person is on the phone with the patient, and the patient tells, the doctor wanted me to come back for a follow-up in the next 3 to 4 weeks. Tell me the first available appointment. And the best days that I can come are on a Monday or a Tuesday. So instead of going to the calendar and searching for the appointments there, while they're on the scheduling screen, they can click on the search button here, applying the filters. The patient would like to come on these specific days. They would like to come at a certain time, earliest, next day, next month, next quarter. Based again on the filter that I apply and say fine, it will go and search the first available appointment that I can confirm with the patient and take that appointment. That is
Right,
also
but this is
applicable.
something that I, as a provider, I'm not going to be doing this though.
You won't be doing this. This will your scheduling personnel will be doing that for you. And which provider they are scheduling it for or which location they are searching for. So those options are available there as such. When the appointment is scheduled, it will show up on the screen right there with the patient being highlighted. So this is my daily provider view. I have a weekly view that I can see the week at a glance. I have a multi-provider view. When you have multiple providers, the multiple providers I want to see, let's say multiple providers here, I want to have more, I can click on the arrow, or I have either this scheduler works only with the 3 providers they want schedule. It can be customized in that manner. Now, when I click on a patient, you will see the information showing up on the patient information here, but I click on the name here, that takes me to the detailed demographic screen where I could see their address, their contact details, other information that includes your language, ethnic group, race, and religion, which are important from the meaningful use criteria, the other physicians in the area who work with this patient, along with the billing information, their 30, 60, 90 balances with the patient's picture that you can capture through a webcam, digital camera, or even scan their ID in. Now, this billing tab may not be applicable for you because I understand you are using a third-party billing service and you will be giving them a super bill. Am I correct?
Right.
Right. So this will be grayed out for you because you don't need that. But if you are using our billing program or if your biller is using our billing program, then you will be able to even keep a track of this information as such.
How does
Now,
this check the validity of their insurance?
yes, let me show that to you. So when the insurance information is entered, and insurance I can go from multiple places there. So let me show you from the scheduling screen. So when I hover my mouse on this multi-dot icon, it goes and pulls up the insurance right here, the eligibility here. Or I can just click on the insurance, look at their front and back of the insurance card. I want to check on their eligibility, pull up the eligibility right there. I also want to cross-check that, hey, the demographic information that I have on this patient is correlated to the insurance. I can just click on this button and look at their demographic information that the insurance has to what we have, and something that is different, I can even modify that by updating that in the system. If it's a
Is
new
there any
patient,
automatic eligibility check that this does prior to the visit?
yeah, it will. It will do an automatic check. We can run a process saying that, hey, all the patients that are being seen on Thursday, I want the eligibility to run today at 2 o'clock. It will run that and be available there for your staff.
So, I mean, in other words, we determine how much in advance that we check the eligibility?
Yeah, you determine on when you want to have those run automatically and be available for you. But
Because
you
I've
also
seen some programs do it the night before, other ones do it 2 days earlier.
you can
I've seen.
whichever way you want. You want the night before, we'll have that set up for night before. You say I want it 2 days in advance, I can have that set up for 2 days in advance.
Okay.
And of course, you always can do the real time. Just when they come in, just do one click, boom, and check it out right there as such. Okay. And there are other things too. You can capture the pre-authorizations, put the authorization charge code from which date to which date they are applicable, how many visits they are approved for. So it keeps a track of all those things as such. Now, the patient, of course, there are several other aspects that we cover here on the screen, and I'm not sure whether, is there any copay and all collected during the visit?
Sometimes.
Okay, so in that scenario, let's say when you highlight the patient, check them in, it will also tell you there's a copay involved. It can also collect the copay there. Are you collecting by cash or credit card? And you can generate a receipt and give the patient as such. So when I say
Do you
save,
have a do you have a means for us to collect by credit card?
yeah, we actually have tied up with two companies. One is called Integrity, another is called PayPros. So if you sign up for your with any of those, when you swipe the card, it will automatically put it under the patient bucket, and that you can actually, it will also show up on your super bill as well in terms of what payments were collected and all those things, and you can give them printout of the receipt as such. So there you can
Do
see
you know what those two outfits charge?
it is based on your volume and all what you negotiate with them.
Uh-huh. And do they provide a scan something to scan with or swipe with?
Yes. So there are different options that they provide you. based again on your volume and what fees and all those things, you can decide what you would like to go with.
Okay.
So let's go back onto the home page. There are several aspects here, and one of the things that comes up is that the patients fill out all this paperwork. So those paperwork, instead of entering on paper, can be entered by the patients electronically, and these icons here represent the patient forms. And let me click and show you some samples. This again will be replaced by exactly the way your form looks like, with all the data elements that you would want to capture. When the
So this comes out on the patient portal?
This will come out on the patient portal for the patients to enter electronically using their laptop, tablets, and all. For any reason they did not enter that at home, when they are visiting your office, sitting in the lobby, you can give them a tablet that they can go and fill it out. The way they could do it is that they just put their first name, last name, date of birth. It will check them in and invoke the form that they have to sign. And they can also sign their consent forms and all electronically on the tablet or sitting at the home from patient portal as well.
So this is basically a kiosk option, so to
That
speak.
is correct. You can have a kiosk, you can have the tablet. A lot of practices use iPads and all. You can use Google Chrome tablets, whichever works for you.
It'll also work with, let's say, Android tablets.
That is correct. Google Chrome,
Yeah.
that's what I was referring to, Android, yeah.
Okay.
Now, the patient has come in, we see that the patient has arrived, but now how do I start my encounter in a patient? But before I get to that, you see there are different icon colors here. So what does those represent? Yellow means that the patient did not fill out a form. Red means that the patient did fill out a form. So let's take the scenario that the patient did not fill out a form, and I will also show you when they filled it out where you will go and review that and get populated there. So the way I start my encounter, I just click on the patient's name. It takes me to the face sheet that gives me a snapshot of everything that is going on with this patient over a period of time. The number of segments as well as contents in those segments, everything is customizable. Now, this being established patient, all this is showing up. If it was a new patient, all this would be blank. And what the staff member would do, they will click on the patient form, review what they have filled it out, and while discussing with them, they can even add, modify, change the data. Only when they say accept, that will go and populate the respective areas of your face sheet and other portions of the chart. Now, today this is an established patient that comes in. So what we are doing, we are checking with them, hey, what are the changes from your prior visit? Now they tell you, hey, I'm on a new medication that I went to my gastroenterologist that they gave me, and I don't remember the name. All you have to do is click on this current medication tab, click on this med history button. It will go and pull out list of all the medication this patient has been on for the last 2 years with whichever pharmacy they have visited. So something that they don't remember, something that they forgot, or they are hiding from you, you still be able to go pull it out and add your medication.
In other words, this could pull it from SureScripts.
That is correct. It is using SureScripts to pull it out. Now, since I reviewed that information on the medication, put a check here that I reviewed it. Do I have to click on each of the segments to review them individually? Not necessarily one click. I can check the box. It will, put that in. What happens if I don't check these boxes? While closing my encounter, or when I'm doing my E&M coding levels for billing, or when I'm reviewing my meaningful use calendar for the stimulus, the system will alert me that we have not reviewed some pertinent information. It won't force you to just give you a reminder. You also have this health reminders here based on the different protocols defined in the system. The system can alert you something that need to be addressed on this patient in the future in the black color, something that is due and not done in the red color, something that has been taken care to show in the green color. You also have multiple face sheet. This is my first face sheet. You may say, hey, this looks too busy. I don't track vaccination. I don't want this personal notes. I want maybe have past medical here, medication here, and maybe the health maintenance here, but rest of them I don't need. I may want that in a separate sheet. You have the option to have multiple face sheets. So here I say, hey, I would like to see this face sheet. This looks differently. Or I would like to have the previous chart showing up. I can have this as my default face sheet.
On the face sheets, I like it very much. Can I change colors if I want on that?
So the colors here are not changeable. It only
Okay.
based again on the parameters that it needs to track. It tells you that, red, here if you see surgical, this is showing as red. Basically, this is more relevant for the visit and all that you marked. So if you see here relevance, then only it will tell you that it will show in a different color. Otherwise, it will give you in this option.
Okay.
Also, as I showed you the previous chart, or maybe I want to like look at their maybe the lab results, or any of the things that I'm tracking and all, I can review that information that matter. So a
By
practice
the
can
way,
have up to 10 face sheets.
for the patient portal part,
Mhm.
can I have it that they can fill it out in a foreign language and it'll translate into English?
That is correct, sir. So when you say foreign
Spanish,
language, which languages are you looking at?
Spanish, French, Russian,
Sure,
Creole,
no
Hebrew,
problem. So
who knows?
those forms and all.
Serbo-Croatian.
Yeah, those forms and all, whichever language you want are possible. Like Spanish, we already have them. We have several Spanish, you know, uh, doctors that use our software. In fact, we have close to 150 clients in Puerto Rico.
Bengali, you know.
Yeah, the only thing is the internalization of that forms, even though you say it's in Bengali, it's showing in Bengali, but it is mapped to the English aspects in the system so that when they check that box over there, it automatically shows check the box in here once you accept it in English here. So
Right.
yes, that can be done. We have done Spanish, but now when it comes to other languages, the way they do in Spanish is possible in other languages. But only thing is I will have to check on the internationalization of those forms, because those forms and all needs to be the fonts and all need to be supported for it to be showing up in that scenario. As far as I know, it is yes, but I can reconfirm that to you.
Okay.
When I go to my next step, which is my document list, this is a central repository of every chart that I have on the patient in the system. So let's say I want to go and review this chart. The patient was here on 7/14, or maybe on 2 years back or 3 years back, I saw this patient. I just want to go and look at the chart that I did. I can go pull up the chart and review that information in that manner that shows up there as a pop-up. However, this pop-up can be annoying. So I go open it up and then I close it and I want to see the next chart by opening it up. Rather, what I could do, I can just highlight and say preview. That will split the screen to two and I can see the chart information on a split screen right there. Excuse me. Let me go and open something else that's a blank one. So there you go. Many a times in the practice, you also get this request from other entities that they would need the chart. Like the hospital wants a chart, the insurance company wants a chart, the provider that you are referring this patient to wants a chart. So what the staff would do, they will make copies of those charts, mail it to them or fax it to them. Here, all you do is check the box of the chart that you plan to send to them from a letter writing module with a covering letter. You can fax all the selected charts out of the system in one click. No more printouts are necessary. You can also send any of these charts to a secured email system to the SureStep network that we use. Now, when I go
Can
to
I
my,
have multiple charts, patient charts open at one time?
can you repeat that again?
Can I have multiple patients' charts open at one time?
So multiple patients, the way you can track that is, so I am on this patient right now, but I want to go and open a chart of a different patient. I can click here and I can select which patient chart I want to. However, if you see this button here, it will give you quick access of all past 10 patients or so that you can say, hey, I want to go and look at Ryan King's chart. It will go pull it up. But now I want to go and pull up Deborah Brown's chart again, so I'm back on that. Or I want to go and pull up Hampton Bryant chart, so I'm on that. So this is a quick view rather than showing you multiple tabs and all. It gives you the list here that you can go and pull it up and see that information.
Got it.
Much cleaner that way rather than having showing up there.
Perhaps. Okay.
Okay. Now when I go to my vitals here, we interface with the Welsh Allen's vitals equipment so that you can download the data electronically. You also have the history button for you to keep a track of the history of the patient vitals over a period of time. You can plot or trend any of this information on a graph if you would want to. So all those functionalities are available there. Now, many a time the providers ask me, these patients, I see them repeatedly for the same problem again and again. So do I need to enter all this data? Can't I just have automatically copied all that information so that I can just make the changes and save that as a new visit for the current date? The answer to that is yes. We have a property when we set it on. Whenever you open the chart of a patient that you have seen before, it will automatically copy the entire information from the prior visit that you can review, make changes, and save that as a new visit. However, even go a step beyond that. Let's say that last time they came was for back pain, the prior visit was for abdominal pain, and today you want to bring over the chart for abdominal pain. So what I could do is I can just click on this button here, the copy, which is available on every uh, you know uh, option of the program. I can say, hey, go and copy the information from this visit. It will go and copy it, and then I can go and modify what is it different today. So I can go page by page rather than going, you know, uh, copying the entire thing. And now since I copied it and modified it, also tells me which were the ones that were copied, which were modified there.
Okay.
Of course, Vital is a bad example because you end up doing every time. Just for the sake of demo, I plan to show that to you. But when I go to HPI, that will go and give me a list of all my complaints over there. This patient coming for abdominal pain, I start typing it, filters out, I could go and select that. But they also have a tendency to maximize their visit. Now they tell you, hey, doctor, I am also having back pain. I also, and looking at their, let's say, history, we see that they are hypertensive and all. So I would want to go and select that. So based again on the complaint list that I selected, it will give me all the relevant options that I need to ask. Some of the providers like the point and click. Some of the providers say, you know what, I don't like to point and click. I want to dictate my notes. In that scenario, just go place your mouse using drag and start dictating. It comes beautifully well. If you say this area is too small, double click on this area. It will go and pull up a larger area for you to go and dictate. You can even have your macros stored, like your paragraphs or phrases that you use frequently, to go pull it out and select in that manner and pull it out as such. If you are using the templates to and all to select, well, I can select here, hey, it's a right upper left upper quadrant pain. This has been happening for the last, let's say, 4 days or so, which is a intermittent pain, more like aching, cramping, burning. So as I'm defining these parameters, it is generating my notes in the background instantaneously. If I'm
How about
selecting,
intensity if I give it a number value instead of like 1, 2, 1 through 10?
yeah, you can do that too. So like the
How do
pain
I do
scale
that?
and all, and you want that to be calculating the, you know, uh, some kind of, if you're tracking what you call like scores and all, the options are there.
So I can have that built into your pain scale?
Yeah.
Okay.
So let's say I want to select all of them. Instead of selecting them individually like that, one click all select, uncheck the one they did not do, go and modify what is different there. Same way when I go to my back pain, I select all these options there, and let's say this is more like a lumboscarsal or low thoracic pain, I can select in that manner.
Okay.
So based again on the things that are being done, it is being documented. But let's say that while discussing with the patient, you also want to document your conversation with them. In that scenario, you can type, write, dictate here, or you can have your macro, something that you
Is
write
all of this
frequently.
stuff coming up in history of present illness?
These all coming as a part of the HPI, that is correct.
Now, can I have the medical assistant do this and then I can
That is correct.
um,
How you want
edit?
the workflow for your office is all set up by you in terms of what actions the medical assistant has to do, what you would like to do. It can be all tailored the way you would like to have your workflows.
Okay.
Now, let's say this is all done by the medical assistant. Now they want to hand over the patient to you for further evaluation. Let's also do the review of systems, and then we will do that. So when I go to the review of systems, the medical assistant actually reviewed the form, and if the patient has filled out electronic form, all this will be pre-populated based on what they filled it out. Let's say they did not fill out. Your assistant has to do it. One click all normal. then go and point out what is abnormal. If I'm reviewing all the systems, one click, all select, uncheck the one that I did not do and all, or what they are not, what is not relevant, I can take it out like that. Or I can even customize based on the visit type or the complaint they're coming for. I can have only the relevant information of review system. I have different templates over there, only the one to get populated and for you to go and select from. Now the assistant did all this part. Now they want to hand over the patient to you. What they would do, they would click on this button here which says patient workflow. They will say the patient is now ready for the doctor, in which room number. So on your home page where you're logged in, you will be able to see this patient is now ready to be seen by you in room number 113.
Well, what happens if we only see in one room and I'm in the room? They have to send them in to me.
So basically you're changing the status. You're in the same room. They are saying they're ready for the doctor because they are logged in as a medical assistant. So you cannot,
Right.
they cannot just give you the tablet and say, hey, go and use it, because you need to have your own login password there, correct? Or they will just, you know, lock it out and you will go put your credentials in for you to log in, so that shows they're ready for the doctor.
Okay.
So now when you click on this, you will be able to see, hey, what all the medical assistant did. If they had added something new, it will show in a different color for you on what they have added. If I go to my vitals, things that they changed shows up here in a different color right there for you, because the one in copied are in yellow.
Can I change the fonts or the size?
So the font and size, I don't know what resolution you're in. On my screen, it is pretty big right now. So based on your resolution of the screen, yes, you can. So currently
I
I'm
could
on,
use it a little bigger.
pardon?
I could use it a little bigger.
Right. So
Oh,
currently the way I am set up on my screen, my resolution is set up to, I think, uh, uh, 1024 by 768 or something more. So depending upon your resolution of the screen, it may be showing up a little. Is it occupying the whole screen or only a part of your screen?
well, this plus the sidebar is occupying the whole screen.
Oh, the sidebar, you need to minimize that. The GoToMeeting sidebar? Are you talking
One
about the
second. The
GoToMeeting side?
sidebar, which is encounter, patient forms, doctor form, phase sheet.
Oh,
That's
that one. Yeah. So I can actually minimize that in that manner if you want, like that.
okay. But then the systems list also is taking up part of it.
System list, where I'm seeing the system.
Next to the left of vital signs.
I don't have any system list here.
Sure you do. Systems list to the left of
Oh,
vital
this one.
signs.
Yeah. Okay. Oh, that part. Yeah. So that, again, that is the different columns and rows created within the system for you to see. But if you say, hey, I want to see this in bigger, I can change my resolution of the screen and you can start seeing bigger there. You know, display settings, I can go and change that. But again, that
Well, again, can I change the fonts or the size of the fonts?
you cannot change the font. So I just increase the, you know, like this big by putting the control and all. I zoomed in and I am zooming it out like that.
Oh, all right, fine. Okay, got it.
So that is all based on the computer or the aspects that you are using in there. So now when I go to my HPI, where, you know, what the medical assistant did, I can see that there. Same way I can go to my review systems and see there. Or I can just go to my physical exam and complete my physical exam on what I am wanting to see on them. Here again, all the templates are available. I can go and review what I'm doing and all. And depending upon what I'm marking out, I can also go and mark out on the diagrams if I need to. These are all customizable as well. You have several of those diagrams available there. And based again on where I click what I do, I will be able to go and, you know,
I
and
can
learn.
add other pictures and also draw freehand.
Yes, sir. These
Okay.
are all coming as a default pictures, but there are several of them that we have in the repository. But just in case if you use some specific pictures, we can add them as well.
Okay.
And if you say I want to draw on the diagram, we also have called something called draw tool here, where you can bring up a picture. There are few examples here. I can select that and I say, well, this is a back pain patient and they are complaining about radiating pain and all. I want to go and, document it. So I can say, yeah, the pain starts in this area, but it goes like this, and I want to annotate a note there. So it can show up. And from here, let's say I want to go back to my physical exam. I can just go, I can just go to the physical exam and say, hey, let me go and complete my physical exam. I want to complete the musculoskeletal part of it, document it like that. So I can go back and forth in that aspect. Now, when I go to my next step, which is my procedures and all, if I do any, those will show up here. Let me go and select a simple procedure. There are several of those options based on what you do will be available there. When I select that, the information will show up. I can select what all I did. And once I save it, it will generate your procedure note as if you have dictated.
Okay.
And this is all customizable, editable, and all as such. Something that I want, something I want to take it off, I can do that. Now, when I go to my assessment, based on the selection of my complaint in the HPI, it went and pulled out the diagnosis codes for me. If I'm
Can you go
happy
back?
with,
Can you show me physical exam? And we didn't go through that. Yeah.
we did briefly, but
Oh, okay.
and based on what you click on, appropriate information will start showing up for you to review.
So if I click the box in the upper left, that'll show everything is normal.
Yeah, so if I click here, every of them will become normal. But if I want to click here and say this is normal, I can go and select and then go and point out what is normal.
Got it.
Or if I don't want all of them, and I only want, let me not select this. Let's say I want to select. So when I select on the left, right side, it automatically checks those that I'm reviewing. Unless until I want all of them. So one click all normal, then point up normal. So now when I go to my assessment, as you see, based on what I clicked on, the appropriate diagnosis codes are coming. But let's say this is more like a generalized complaint, but I want to be more specific. I can click on the C button. That gives me the other compliant code that I have customized the system for, and I can go and select the information that manner. Same way for back pain, let's say it's more a sciatica or maybe a stenosis or something, I can select that too. And I can say, hey, I don't need this, I don't need this. I can uncheck and I can say this is my primary code, save it. Now the other thing is, based on the governmental guidelines, you are supposed to be giving them education material. So when I click on this edu button, it will go and pull up the education material in real time from National Library of Medicine right there, that you can share with the patient on the patient portal or give them a printout or email it to them. So all those options are available there for you.
How about e-scribing?
Yeah, I'm getting there. Now, when I want to go to the e-scribing, I click on this RX button here. That will go pull up the prescription screen.
Where was that? I didn't see where that was.
I can RX here.
Got it.
Yeah, I can go from here or I can go from here too. So I have the prescription here as well. So if I click here, it will go pull up the information right there. It will also pull up all the pharmacies in your area. Again, give me your zip code, sir, where you are in.
11221.
So I select 11221, show me all the retail pharmacies in your area. We'll go pull it up. Let's say the patient prefers to go to this Rite Aid Pharmacy or Anbali Avenue. I select that. It also tells me it's ERX and EPCS. EPCS stands for Electronic Prescription of Controlled Substances. So we are certified for you to send controlled substances electronically. Give me a drug name that you want to prescribe.
Trulicity.
Okay, so I remember
Truli.
last time I did not show that to you because I showed it to you in a different database. On this database, I don't have that set up because this has not been updated here. So give me another name, sir.
Jardiance. Jard.
Why is it not? Let me see this. That is interesting. So give me 1 second, sir. Let me,
Invocana, INVO.
no, I can show you all of them. This database is not set up with that. So let me go and pull up another database there so that I can show you every drug that you're looking for. Let me go. Yeah, any patient would be fine here. Okay. So yeah, so Trulicity,
TRUL.
TRUL. Okay. Okay. So there you go. And it also tells you the, and the strength available in the
2.5.
market and all.
Right.
I want to see the information on that drug. It will go and pull it out right there for you. And let's say that I want to add another one. Give me Jardian, correct?
Sure.
JAR.
Yeah, you got it. It's the first one there on the top.
Okay. I select that. It
25.
also,
Right.
I can select whichever I want and how many days I want to give, and so I can see the information on that drug right there. And once I save it, it gets added right there. It also gives you, well, these are all I selected there, but you have your preferred list that you can go pull it out from your preferred list. You also
Right.
can also see the entire, you know,
I can have my preferred directions already.
yeah. So once you put a direction there, it will automatically remember that whenever you go and give that drug, it will automatically remember that, pull it out. But once you modify it, from the time you modify it, will remember that from that point onwards.
Okay.
It will remember the last given directions there.
Right.
And of course, you can go pull out your past medications that you have given. You can re-prescribe those medications. Let's say I want to go and re-prescribe this medication here, or sorry, not this one. Let's say yeah, this one here. I can go and select that. I can save it. It will check the interactions and all, if any. I can send it electronically, fax it, print it, preview and print it. So all those options are available there.
Can I do several? Can I put oh, right, I got several here, and then I can send them all as a batch?
Yeah.
Okay.
So let me go back onto the other database there where we had the rest of the information to show. And let me select something here. I think it should TRUL, correct? Why am I not having, I'll have to have this database checked out because why is this not showing up? I don't know, but let's go and let's say, I'm just selecting something. Just for the sake of demo, I selected something so that you can see what I have done in the chart, and also it also gives the interactions in that manner as such. And again, I did not following is inactive. Okay, fine. Let me go and close that. Now, similarly, you can order your labs and all. We interface with over 100 labs in the market. LabCorp, Quest, CPL, BioReference, all the different ones. And you can also create your own order sets. Instead of selecting individually, you can say, hey, I want to order a diabetic panel, or maybe I have created my own panels or something. I can do select, add it, create the order. Now, based again on what all I have done, the system is keeping a track of all the system element bullets and all here. It also tells you the level of code applicable for this visit, but there are two important factors: the medical decision making and the time. So as a provider, if I say this is a low complexity, to tell you it's a 99213, if you need to go to the next level, what else you need to do? However, the time has an important role too. So let's say this patient had so many questions that you have to spend more time. If I put the time in and then the complexity, because the time has an overriding factor, it bumped the code to a 99214. So I could go and document that, save it. And now when I go to my note, which again has been ready all along, as I was clicking, the notes were getting ready in the background instantaneously. So there you can see, based on the clicks I have done, Deborah says pains located in the right upper left upper quadrant. She has been experiencing for 4 days. The onset of pain is intermittent. Pain is aching, cramping, stabbing in character. So all these are coming to the clicks. Some of the language may not be relevant here because this is my demo database, but it is tailored to the way exactly the way you would want. Back pain, same way. Hypertension, I did not do, so it's showing up blank. Current medication, physical exam, the diagram that I added, the assessment plan, everything ready to go. I want to send this note to a physician that I'm referring this patient to. Patient, letters out, I'm on the letter writing module. I can select which patient, which provider I'm sending it to, select that. Name and number comes up. I can have my pre-formatted letters. I can, there say referral to a specialist. My letter is now ready to go to that provider with only the content that I plan to send. So let's say that, hey, I did not do this. I want to take this off. I want to add something else. I also want to send, let's say, the lab results I got. I also want to send the procedure note I did. I don't have to leave the screen. I just click on this attach button and say, yeah, send this radiology results and this lab results and this procedure note. So this is my first page of the letter. My second, third, and fourth page, I can click and see what am I sending along with that letter. So all I
Let
have
me
to
ask
do.
you this. With labs, mostly we're using Quest and BioReference. The thing with the BioReference, I very much like the way their reports come out. Can I have it show up on here the way their reports print out on our printer?
So when the reports come in, if you are getting the report like a fax or something, yeah, sure. Because what you could do is when the report comes in, let's say this is the report from them. So you will be able to see that your staff will be able to see this is the report on which patient. They will select the patient and put in the lab category and say attach. So that will show up there, and that will show up on your document list on the report exactly the way it is looking like. But typically the way the electronic labs, when they come in, they are mapped to certain fields, because if you are getting as a report that is not mapped, it is more like a PDF file that you're reviewing it. But when I go to my, let's say, the lab results here in CPOE, let me go and pull out all the results that are pending to be reviewed. So if I go and pull out a report, it will let me go and select a different patient there because I want to show you a little bit more in detail. Let me go to Mary Baron. Yeah, so the results will show up, of course, in this area in whichever, whatever you have ordered and all. But you can also track the matrix here too. Say, hey, show me all the results that I would like to see over a period of time. So you'll be able to go and see the various aspects there. You can plot them on a graph and all if you want to. All those options are available there for you.
Can I get it both ways?
You can get it both ways, sure. If you are getting as a electronic, HL7 file, it will pre-populate it. And if they're also faxing it to you, you can attach that as a fax.
Or as a PDF file, whatever.
Yeah, exactly.
Fine.
That only puts an extra, pressure on your staff for them to go and attach that, manually,
Okay.
because electronically it is coming as a discrete data.
Got it.
And while you're reviewing the results and all on this screen or on this screen, you also can track, hey, what prescription they're on and all, what is their phone number, you want to make a phone call. Those things can be done as such. Any questions?
Not for the minute.
Okay.
Also, when we're coding,
Mm-hmm.
can I have a favorite list for ICD-10 codes?
Yeah.
Based on our super bill.
Uh-huh.
They look like our super bill.
Yeah. So when I'm going to my assessment here, you see I pulled up this one, but if I click on this plus sign, that is your preferred list right there. You can have your preferred list, general, where you can search for anything. I say BACK and I say LUM, so it will start filtering it out right from that and say back pain, lumbar, so I can select like that. Or I can have my custom defined list. I can have a drill down list that I can search from. Again, this also comes from filter by patient age or by gender. There are various aspects. You will be trained on all different aspects based on what would be ideal for you.
Okay.
So we went through the progress note. We went through the, sending the what you call letter and all. I also showed you how to attach a lab or a radiology result or maybe a chart that was scanned in that can be attached as well. It also gives you like some of those statistics that you want to keep a track of and all, which are customizable. It also gives you the meaningful use dashboards and all as well, you know, that you can run at any point of time and see how are you doing on those measures and all. Then the other thing is you have completed all this and you want to give a super bill to your biller. So
Right.
you can have the biller access to the system so they can pull it out, or you can have a system generate for the end of the day. You want to have a combined super bill kind of a scenario, or you can say I would like to have an individual super bill to be generated. So I can go and progress note report and say, hey, show me the super bill. I can have different formats over there. I say this is the one I want. So it will go pull up the diagnosis code that you use, the procedure code that you use, the details, and if they paid any copay, so all those things getting generated in that manner that they can be pulling it out.
Okay.
So this is one format. As I said, there can be multiple different formats the way you would want. It can be tailored to exactly the way you would like.
Very good.
Any questions, sir? Anything that you have in mind that I have not covered so far?
Reports.
Okay. So the reports, there are several reports available. Of course, these are the MUQQP reports. There are audit trail reports, PQRS reports. But if I say I would like to see my encounter reports or maybe tabular reports. So here
Supposing
again,
I want to see all my patients who are diabetic that have a hemoglobin A1C between 7 and 9.
okay. So here I have the patients with A1C more
Oh,
than
all
8
right.
is what I've selected, So when I
Fine.
select that,
Okay,
of course, this is my demo database. It will not have a lot of data or it may not show up with anything at all. But I have not, because I have not entered any data there. So when I go and run that, again, these are all customizable reports. It will go, no records found because I don't have one, but date, chart number, patient age, date of birth. So it's just all pulling the data. But if I say the result, that result will show up there. And remember the other day I showed it to you, the reports and are all configurable. So if I go and let's say, let me show you the tabular report that I ran. These are all the SQL statements that are put in the system and which uh, title and the width of the column and color and what values it should put in. That's how I'm setting up the report and save it so that you can run that at any point of time.
Okay.
So like that, yeah, there are patient reports, encounter reports, tabular reports.
That report you just showed me, the A1C, where did that come under? Under which?
So that came under the tabular report.
Okay.
Yeah, and I selected it because here again I have several of them, but I say I go to this part and so I'm pulling up from here. But let's say these are reports that you run frequently on your side and you want to have them preferred. I said all reports, you will say my reports and see only your report that you want to run frequently. I don't have any frequent or preferred ones here, so that's why I'm running from all there.
And I create my own criteria also.
Correct.
Right?
Yes. Again, the program has a lot of capabilities, sir, depending upon, as I said, when I go to settings and configuration, this is the whole engine behind the program from where the system is being set up. My next meeting is starting there, but let me go and
tell me about implementation and training.
Sure, sir. So how many providers are we implementing here?
Well, there's myself, a PA, a physical medicine rehab doc. We also have a couple of, if we include them in it, we also have a couple of physical therapists and acupuncturists and ultrasound tech, and a few other things.
Okay, sure. So I know I sent you the proposal. Were you able to review that?
I did. I think I did. Yeah.
Okay.
Let's look at it again.
Okay, so I can resend that link to you again for you to see if you want. Now, the way typically the implementation works is that once you sign up, we have an implementation manager assigned that will work with you closely. Set up your database after discussing with you based on what all you do, because we have a repository of different specialty databases. So we'll pull out all the relevant content for you, put together in your database, guide you through the process for you to review, understand any fine tuning that we need to do, and we do the fine tuning and start training you. So all this process typically takes, again, based on the time that you specify that you have, it takes anywhere from 4 to 6 weeks. There are clients that have gone live within 2 weeks too, but with bare bone aspect of the setup and all, and the implementation continues. Otherwise, if you say, hey, everything has to be set up, typically the time frame is 4 to 6 weeks.
Okay. Do we have unlimited to help in terms of training and
So the training, again, with the, the proposal that I've sent you is typically 3 days of training, that is 24 hours, that can be split into 24 sessions of 1 hour each, or however many sessions that you would want. Like say, I have 2 hours today, 2 hours tomorrow, you can split into that scenario. If you want additional training, you can let us know and we can provide that to you at a discounted fees.
I'm sorry, you can provide it to us what?
The training is chargeable. It is provided. Currently, I have offered you at a discounted fee if you see the proposal that I have sent it to you. So if you need more training, it will be offered you at a discounted fee.
Okay. All right. Got it.
So let me go and stop the recording here. And